All right. Shalom, Lucky Lloyd and Jamal Bey. I hope everybody is doing well. We're just going to give it a few minutes to allow people to come in. Boy, I tell you, I just can't believe. Every day when I wake up, I can't believe how much life has changed in this country. I can't believe it. But we're here. Shalom. Tenjon. Zu. Shalom, Rosie. Okay. As soon as we get more people in, we'll get started. Shalom, Daily Read and RJ Connections. Dwight. Lexa. Backup Trick 44. Fit. Fierce. Over 50. I bet you are. Lady D. Anthony Black. That's Adonald Ship. All right. Shawnette. Shalom. John Anderson. Anita Williams. Mr. Pirate Brain. Shalom to everybody. Cameron Charles. Joel Gillette. All right. As soon as we get a few more people in, we'll go ahead and get started. Shalom. Shalom to everybody coming into the chat. Barazal Bless. Shalom. Clarence Dunn. Brenda Hill. R. Garan Jordan. Tasha Langley. Pink Meadows. Shalom, everybody. Shalom. Okay. Shalom, crystal clear. All right. All right. So we got about 92 people. I'm just going to wait until we hit over 100, and then I can go ahead and get started. Yeah, I mean, I notice a lot of people are complaining about being under quarantine, but those will be the same ones by next week. They'll have coronavirus. You know, they are the same ones that think their lives should never be inconvenienced. Are you crazy? You're not supposed to do that to them. Yeah, right. Yeah, whatever. Okay. It's going to be Saturday, Anthony. Yeah, Anthony Butler. It's Saturday, 12 noon. All right, y'all. We have 111 people between my two channels, so I'm going to go ahead and get started. Well, you know, when we started out, I'm going to go ahead and share my screen also. All right. Just let me know if you can see my screen. Just go ahead and give me a 1 if you can see the screen. Shalom, Kevin. Yeah, go ahead and give me a 1 if you can see my screen. Thank you. Thank you very, very much. Okay. Now, when we first got into the topic of coronavirus, it was a big thing in the media back then about the most vulnerable populations, which we know are elderly people, because by the time they're old, they have a lot of health problems. Many of them are taking meds, and their immune system is weakened by the time they start reaching up in old age. So most of the baby boomers in America are white. I think it's like more than 72% are white. This is the root of the problem and why they have switched off to Black people, ladies and gentlemen, and now have made us the face of coronavirus, is because too many of the people that look like them that are elderly are dying, and they don't want that out there. You can also see right here, so there are 76 million baby boomers in America. Of that 76 million, 72% of them are white. And remember, this is the white population, last biggest group. So once they die out, all of the other generations are way smaller. So this is what we saw initially. COVID-19 impacts multiplies for seniors and vulnerable adults. So if you have any pre-existing conditions or you're up in age, because some states are even recording the average age of people that have died of coronavirus is 65 and older. It's not everywhere, but this was the headline. So you can see this is March 20th. Now, it was maybe a little over a week ago. That's when they start jumping on Black people being the face of coronavirus. But we know it was not always that way at all. This is pretty recent. And I want you to also see the headlines. Right here, coronavirus deaths in U.S. nursing homes soar more than 5,500. Now, like I said previously, in my state, they are saying that the nursing homes in the state, all of them have coronavirus. Not some of them, all of them. And New York is also battling with the same issue. And as you can see, you see other headlines for elderly people. CDC, 80% of the US coronavirus deaths are people 65 and older. See, this is what they started saying. Then all of a sudden they switched on us. But you can best believe this is still going on. And it's very prevalent in the country. But these are affecting white elders more than anyone else. Coronavirus fear, isolation, death to elderly worldwide. Now, if you notice, it don't say Black people worldwide. They just stick with Black people in America. They don't dare say worldwide because it's not worldwide. And I don't really believe it's as big as they're claiming anyway. Elderly more likely to die, but in Colorado, coronavirus strikes all age. Elderly left in the lurch, and this is in the UK. Global coronavirus update, protecting elderly, educating amid virus. All right. So you see right here, Colorado confirms 357 coronavirus deaths. That's outbreak at senior living centers continue to rise. So it hasn't changed, you know. Here's another one about a nursing home, Michigan. So elderly people are very much a death soar in Britain, care homes as COVID virus stalk elderly. So these things did not change, all right? But they changed the narrative to us, ladies and gentlemen. Just understand, number one, let me see who sent me this. Thank you, Tremel Nichols, for the super chat. Number one, just understand the opioid deaths in America did not stop. That didn't stop among the young. They just kind of erased it from the headlines now because so many people are dying, that are elderly. So now think about this. You got a younger population getting wiped out by drugs, and now you got the biggest senior population, and they are now threatened in dying from coronavirus. And they are all dying. Now, I also, let me share this with you that I actually came across. Let's see if I can find that. Oh, here it is. Let me open this up. All right, let me share my screen again and I'll show you this. Okay. Look at this. This came out of New York. Teams are retrieving up to 280 bodies a day from New York City homes. Not all of them are counted in the official death tally. And it's mainly emergency, EMTs, paramedics, and the National Guard is going around and getting these bodies, and they're collecting 180 of these bodies daily. A lot of these people are elderly. The problem is up in New York, they're going to keep finding this, y'all, and I'll explain to you why. The problem is the care in hospitals. The care in hospitals is really bad. It's not good care. So if you can make it up to the hospital, just know you may get kind of lost in the crowd. A lot of people have this attitude now, and I'm starting to see it more and more. They're like, look, if I'm going to die, I want to die at home. I don't want to go to the hospital. And more people are afraid to go to the hospital because we've heard how horrible everything is, and people are just going up there just to die. And if you can make it at home, some people prefer to be with their family, or they prefer to just be at home. Maybe as a person that lives alone, they don't want to go to the hospital. And this is becoming more and more prevalent where everybody is petrified to go to the hospital. How you doing, Katie? Shalom. Everybody is petrified to go up to the hospital because walking up to the hospital can give you coronavirus. There's just so much of it there. Yeah, Darlene X, I'm not going to the hospital. Let me see. If I don't have any respiratory problems, I will not be going to the hospital. You know what? A lot of people feel that way. You're not alone. In fact, I'm coming across a lot of people. They said, even if I'm feeling sick, I'm not going up to that hospital. They don't want nothing to do with the hospital. So there's probably in my state, a lot of people that are deceased in their homes right now. And the sad part is they don't have nowhere to put these people. In fact, there was a nursing home here in my state. The people have been dead for several days, and they just left them in the beds at the nursing home because they said they are running out of space in the morgues. And a lot of nursing homes have a small morgue, but it's usually just for a few bodies. But when you start having 10 and 11 and 13 and 19 people dying, it's not made for that. They can't handle it. So they're now finding that these people are dead at the nursing home and they're just left in their beds. Yeah, the staff is short. You're right, Sam Willis. The staff is short, and many of the staff members that are working in these nursing homes, they're sick. They're sick. I mean, the nursing home is now officially a death trap, and it's really sad. But see, instead of paying attention to this story, they want to pay attention to putting it on us. That's what they want to do. And again, if you go back and look at the Spanish flu, they did the very same thing. In the beginning, they talked about the vulnerable the vulnerable population, the elderly, children, and things like that. When the second wave of the Spanish flu came, they blamed Black people for it. That's what they did. So you're just seeing history repeat itself. We've been here before, and they're just pulling the same stunt that we saw before, unfortunately. And this is the way it is. This is how this country operate. Even during a pandemic, they can't let it go. They still got to come for us no matter what. Yeah, Sam Willis, you bring up a good point. Most of the Black people that died, many of them were essential workers. And that is the key component that the media keeps leaving out. But see, this is exactly why a judgment is on this country for all of the wicketry that we have been dealing with them trying to tell half truths or just straight up lying on us. And, they're going to be pointing the finger at us until they're down to their last breath, unfortunately. Yeah, the bus driver got coronavirus. Yeah, I remember that. And look, cops have died, and I see New York, they're still having a problem with a bunch of cops calling out sick. So none of that has changed. So think about this. There's even around here, there's a lot of Black people that work in the hospital, especially NYPD. They got a lot of Black people on their police force. They have people that work in Walmart and supermarkets. A lot of them are our people. Food delivery, a lot of those folks doing Uber Eats and DoorDash, those are our people. So, and they are the ones that are getting sick because they're still working through this thing and they're getting exposed to the virus. But it just goes to show you one thing, ladies and gentlemen, most essential workers are Black. And most of them are Black. That's why most of the ones that are dying are Black, because most essential workers are Black. That's what it's telling us in this country. Well, it's just like what I was showing you this morning, where my uncle lives down there in Florida. It's going strong in Florida. And then somebody had made a point, well, maybe it's not the same in a dry climate. That's not true, because if you go and look up Saudi Arabia temperatures right now pretty much mirrors the temperatures in Florida. They're in the upper 80s and 90s this time of the year, and it's soaring in Saudi Arabia, and that's more of a dry climate. You know what I mean? So It doesn't matter if it's a more humid climate or a more dry climate, coronavirus is still spreading in both Saudi Arabia, where it's more dry, and Florida, where it's more humid. It doesn't matter. Right. And you got a lot of old people in Florida. Exactly. My uncle's elderly, and you got all those old people down there. And I'm telling you, they are wrong about this thing not being able to survive in a hot climate. And somebody also tried to debunk what I said by bringing up the fact that the ocean was not warm, and which was false. I went back and I looked up the ocean temperature in Florida. It is 84 degrees. So you can't use the ocean temperature as a scapegoat. It's just not true. The ocean temperature, you can look this up yourself, down in Florida is 84 degrees. So it is not true that the ocean got something to do with it coming down. That is false. That is false. How you doing, Loretta? But yeah, the ocean is 84 degrees down in Florida. If you look up the ocean temperature. Yes. So that has nothing to do with coronavirus at all. Yeah, I mean, if you talk to the nurses, they'll tell you who's in there for coronavirus. They're right there with the patient, and they'll tell you. Yeah, it is worrisome. Most of my family, especially in the South, a lot of them are 65 and older, and I am concerned about them getting it, you know? Oh, Loretta's fine. I tell you what, she's probably unaffected by the whole thing. She didn't have to worry about stop working and being on lockdown. She's a house cat, so lockdown is her life. She doesn't care. Yeah, I don't think, you're right, Katie. I don't think coronavirus is going to disappear in hot weather. I think this is far different from a cold or flu. And all you got to do is look at the places right now in America and even places outside of America that are hot this time of the year in April. And you will see the coronavirus is spreading in those locations. It's not withering out because of the weather. It's not doing that at all. So I think they're going to be in for a rude awakening when the hot weather gets here and they're still battling this thing. Yeah, Donovan Ben Judah said, I'm in Orlando and it's been in the mild 80s to 90s, and COVID-19 is still tearing these people up. See, that's what I'm talking about. I mean, when these alleged experts, which I don't think they're experts at all, because they sure don't think very well, these alleged experts that they got on TV talking about, oh, we expect this to die out in the hot weather. Are they looking at the places that are hot now? It's almost like they're blind to what's in front of them. I mean, it don't take a rocket scientist to say, well, let me look at the places that are hot on the planet right now that have coronavirus, and let's see what's going on there. Is it still spreading, or is it just kind of dying out? Is it fizzling out? They're not doing that. They're just standing there telling you that this thing is going to fizzle out, and they have no way of knowing that. This is a new virus to America. So how do you know that? How do you know that? You don't know that until we get there. But from what I see right now, I don't see it fizzling out in places that's hot. That's all I'm saying. I don't see this. So where are they seeing it? Yeah. No, the experts are just your typical run of the mill high IQ people. Okay. Like I said, these folks ran around here talking about how brilliant they are. They got high IQs, they're smart, and we got low IQs. Remember, we got low IQs, but what did they do? They went out and bought all the toilet paper, and then they tried to return the damn toilet paper. I tell you what, if that's a good example of a high IQ, I'm glad I don't have one. That's all I got to say. I'm glad I don't have it. Tasha Langley, thank you for the super chat. We're going to have to be our own healers now. Yeah, we always have been. You may not have access to a doctor in the future. Time to learn herbology. Yeah, you're right. Aromatherapy and natural medicine. Yep, I agree with that. I really do. I think at the end of the day, it's going to be as always. We're going to be out here fending for ourselves as usual. We really are. But I'm just telling everybody, don't hold your hopes on this thing disappearing in the summer like these experts are claiming. I don't know. It's like coronavirus. It seems to be on steroids or something, because it just keeps going like the Energizer Bunny. Thank you, Joseph Washington, for the super sticker. Katie, at this point, I'll be shocked if there's even an election. I just don't know how you're going to open up polling place. And I heard they were talking about a mail-in ballot. I just don't know how well that's going to work. And remember, you got Trump talking about trying to open up the country on May 1st. This country is not ready to be opened up on May 1st. I mean, that is just ridiculous that he is even suggesting such a thing. But I think if he does, it is going to be at the point of no return. They already can't even control this virus, y'all. If you send everybody back to work, it's going to be at the point of no return from that point on. I just don't see how they're going to do this. That went kind of fast. Thank you, Armageddon 026, for the super sticker. Thank you. Mail-in works good in Oregon. Yeah, maybe it does, Black Magic, but what about nationwide? I just don't know how that's going to work out nationwide. Again, you're walking in territory that this country has never dealt with before. I just don't know how smoothly that's going to go. I still remember the time when Bush and Al Gore were running, and then down in Florida, they were trying to count those ballots and hanging chads and all that mess. That was a disaster. Well, I don't know, physically what's going to happen, but I just can't see everything being good for opening up a country and you have not even resolved this thing. I could see if, we woke up and they said, okay, in New York, there's less than 100 people getting it per day, so we can go back to work. That's not the case at all. It's not. And Cuomo admitted that the numbers are being undercounted because they didn't even count the people that died in nursing homes up in New York. So if you didn't count them, and they didn't even get all of the counts on the people that died at home. So that being said, how do you know what your real true count is every single day? You don't know. Thank you, Black Magic, for becoming a new member. Yeah, so all I can say is, if you do have to go back to work, I don't know if some of you are working from home or not. Hopefully, you'll be able to continue to work from home and companies won't make you go back to work. Thank you, Clarence Dunn, for the super sticker. And, I just hate to see our people rush back to work. I just see so much danger in this, and Trump is supposed to give a speech on his plans on how he's going to open the country back up. You're dealing with somebody that think they know everything, and he wants to act as if he's as smart or he's got some medical degree and he knows how to get everybody back to work and without us all getting sick. It's just, to me, you go back to work at this point, it's like a sacrificial lamb. That's just my opinion. Yeah, but we know what's going to happen if. Thank you, Peggy, for the super sticker. The thing is, if you all go back to work and this thing just goes tenfold in the country, Trump ain't going to take no responsibility for what happened, because I know how this man operates. Look, he won't even take responsibility for the way he handled this entire thing from the beginning. Remember, he said it was a hoax. 15 people got it and 0 people will have it next week. I mean, he won't even take responsibility for that. Yes, Sister Blackfoot Winfield, it is all about money. It is. It's all about money. I just think everybody should lay low and let the numbers fall. Let the numbers fall and then talk about people going back to work. But then we're still at the height of this thing. CH464, Lisa, anytime I go into any grocery store or pharmacy, and if I see a brother or sister, always tell them thank you for coming into work, because if it wasn't for them, a lot of places would be closed. Yeah, I mean, a lot of our people are those essential workers. And like I said, that's why our numbers seem so much higher than everybody else. No, it just proves that Black people are the ones holding it down during the pandemic. That's what it means. And of course, going unappreciated as usual. It is, because it's the unknown. We don't know what's going to happen, but I do know it is going to be a major catastrophe if you send people back to work on May 1st. You know, and one doctor I was listening to yesterday, and he was saying the kids got it. The kids got it. He said there's no way children have been exposed to adults with it and they don't have it. He said a lot of these kids in the country now got it. If the adults got it, you can best believe a lot of children got it. Now, the children, because they're young and have stronger immune system, they may be asymptomatic. That's why they're not showing any signs like the adults are. But he said the kids definitely got it. They would have to have it at this point. And this is why, if you notice, some of the governors, like in Maryland, they're already talking about doing public school online and not even attempting to send these kids back even in September. And I think that's the right thing to do. In schools, everybody is sitting on top of each other. The hallways are all crowded in between classes. It would be a horrible thing to send them back to school at this point. Yeah, Lucky Lloyd, kids' immune systems are still developing. That's very true. It's going to be a lot of school systems like that. It definitely won't just be Maryland. I think many of them already know you just can't put all those kids and adults together in one building like that. You're just going to have everybody getting sick. Wow, CD Till, I am really sorry to hear that about your sister. My sister is a nurse back in St. Louis, and she just got the Wuhan COVID-19. Well, I sure hope she recovers, CD Till. I'll pray for that. Yes, more and more places are making it mandatory to wear a mask. That's why when I saw that story on Candace Owens, I said, this chick got to be out of her mind to believe she can go anywhere she want, walk in any store and do whatever she want and don't even have a mask on. Yeah, and they said the whole time she and her husband was in the store, people were complaining the whole time about them not being covered, having their face mask on. A lot of folks did not like that. And you let her go out there too many more times like that, they gonna throw her out of the store or arrest her. She think everything is a joke. People don't want to hear all little babbling nonsense that she got to say. Put the damn mask on. Yeah, they are. In fact, I was looking at De Blasio today. He was saying that too. He said everywhere people go, especially just being out and about, even if they're going into a store for a few minutes and running out, they should have a mask on. And eventually they're probably going to have to do that, especially the longer this thing sticks around. They're going to have to do that, y'all. You know. All right, y'all. I'm not going to keep you too much longer. But yeah, we'll be doing current events this coming Saturday, 12 noon Eastern time. So if y'all can stop by. It should be a lot of fun. We'll be covering a lot of different topics. So, as usual, we'll have hopefully the panel that I always have. And I actually stumbled upon Brother Dawa, Yisrael. I'm going to see if I can get him back for another interview. He said he would do an interview on my channel. So hopefully in the very near future, I'll be able to set that up and we can come together, because I definitely want to hear what he thinks about all of this stuff that's going on. I haven't seen him in so long. I know he's been on Facebook, but I'm no longer on Facebook. I haven't been on Facebook since 2018. In fact, it was probably around this time of the year. It was like around April of 2018 when I left Facebook for good. So it'll be nice to just kick back and just talk to him for a moment. He is real. I really love his message. He's a bit too strong for YouTube, but he's not too strong for me. I love what he got to say. Oh, Sister Winfield, I'm sorry for your loss too. Oh man, I hate to see stuff like that. Well, he was. Now, I don't know if he still is. Now, that I would have to get updated on crystal clear if he was still running for mayor or not. I don't know. I don't know if too many places are going to be having elections in the country, It's kind of hard to bring people to a polling place and be in those long lines and voting, and everybody's using the same voting machines, and I don't know. I just don't think at this point in time that that can really be done without risking the health of the public. All right, y'all. May the Most High be with you and your loved ones through this, boy, times that are changing so rapidly we can hardly keep up. But his hedge of protection will be around each and every one of you and your families. And I pray that you continue to keep your health up during the time when we are living through plagues and pestilence in this world. But just like he saved our people in Egypt, he can save us now. My Heavenly Father, please pass us by when it comes down to any sickness. Hallelujah, family. Amen. Peace, family.